How are you able to adapt technology and leverage the power of patient data to improve your patient care? Join us today with Dr. Karthik Anantharaman, the Vice President of Apollo International Hospital, as he guides us in the pursuit of improved patient outcome through personalized medicine and data-driven patient care. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Welcome back for another episode. I'm your host, Sabrina Runbeck. Today, we have Dr. Karthik here with us, and he is the Vice President at Apollo Hospital System. In 1983, Dr. Reddy changed the landscape of the healthcare delivery in India by launching the first corporate hospital, Apollo Hospital in China. Now, as Asia's foremost and trusted integrated private hospital system with providers, pharmacies, primary care and diagnostic clinics, and telemedicine units across 19 countries, which is amazing to have shared and collaboratively be able to serve so many lives across the globe. And they have a strong presence in telecardiology, teleophthalmology, and a robust health and Apollo International Project and healthcare insurance services. And as a unique way, Apollo has been set up from both helping hospitals to create a new system, getting staff, fundings, operational side, and also training side. So it's so exciting that they has been received international healthcare accreditation by the American-based Joint Commission International, as well as the NABH accreditation. So I'm so excited to have Dr. Karthik here with us to really share how healthcare are practiced and how we should be focusing on this unique way of integrated healthcare system. As we all know, this show is about celebrating the wins, how we're supporting our community, our staff. And thank you so much for being here.
Thank you so much, Sabrina. Indeed, a pleasure to be on this chat and more than happy. And I think there can't be a much better occasion as we speak. Just yesterday, the 5th of February, was the 90th birthday of the founder, Dr. Pratap C. Reddy. It was a grand event. I think he has been recognized as amongst the pioneers in healthcare from Asia. So I think what better, I think I'd like to pay my respects to the great man. And this is possibly a great honor for me to be talking about Apollo Hospitals and what we do. But thanks for the opportunity and thanks for having me here, Sabrina. Appreciate it.
Yes, I love to see we are health care, right? It's actually, if you want to think about as one unity or two separate things of how do we care for health, and that has so many different layers. No matter if we're thinking about the private practice side, the tiny community base, or creating these larger hospital system. And now, just like Apollo has going across the board in multiple different countries on how to shape the way that we deliver care. So what do you believe is something that attracted you to Apollo?
I've always been in what you say, patient-centric organizations. So I've worked with pharmaceutical organizations, I've worked with medical devices organizations. And I think without an exception, almost every organization said putting patients first. They might have said it in different ways, but they truly meant it. And what I mean by that is, be it in research, be it developing new products, services, everything was looking at how can we solve if there has been an unmet medical need, and how can we solve the problem of access, of being able to get the benefit of a product or a service or a clinical expertise to as many patients as possible. That's the background I come from. While this has been my first full-time experience of working with a hospital network, hospital networks such as Apollo have always been my clients in my past life. So the way how I have looked at this ecosystem evolve is, I think, from that principle, Apollo has continued to believe in putting patients first. So everything that you see that Apollo has developed is an ecosystem to ensure that the patient does not have to go anywhere else to seek any kind of service, be it primary care, secondary care, tertiary care, or super specialty quaternary care. One of the most difficult aspects of managing disease today is having an integrated access to everything that a disease may need in terms of its management under one roof. A lot of patients find it very difficult to get this kind of an integrated approach. Many a times, as you know, they tend to go for a second opinion, a third opinion. And if that were to happen from different other ecosystems, instead of helping the patients, many a times we see the patient is left more confused, not being able to make a decision. So I think the way how we wish to approach is to do what is right for a patient and very clearly tell him what is the approach that would help him the most. However, we have to keep in mind that disease starts from its early, if when a disease or a disorder were to set in, it would typically be seen by a primary physician. So that's where you see that we run a set of clinics, and these clinics are in the peripheries. Would also find them in the upcoming tier two towns. And in the clinics, we have specialized qualified doctors who would first make, okay, so can this be treated in a simpler approach just by through medicines or an injection? Or would it need a little more structured specialist approach? So they would make that decision. Next, when you're treating a patient, the patient may need a few investigations to be done. So we have an attached diagnostic center, primary diagnostic center. It does every simple test that needs to be run for common diseases. And the patient will need pharmacy. So you have an attached Apollo pharmacy. So the pharmacies, you can buy the medicine there. And you can also we have an Apollo 24/7 app. So this app is the most downloaded healthcare app in the world today. And we deliver medicines home at the convenience of the home. If a patient needs a repeat investigation, he can order an investigation on the app. If the patient does not have a prescription, because as you know, under regulations, a patient can get a medicine, the patient is eligible to get a medicine or eligible to get a lab investigation done only if a doctor has prescribed it. There should be a valid prescription. Many times, patients see that they don't have a valid prescription. Either they've lost it, they've misplaced it. Many times, it's an old prescription. By medical law, a prescription is considered valid only if it is written by a doctor within 6 months from the date that you request for a test or an investigation or medicine. If the prescription is older than 6 months, a qualified doctor needs to revalidate it. So we offer a network of doctors who connect through a video consultation or a teleconsultation if the patient does not have a valid prescription, offer a consultation and give the right prescription. And only when we have ensured that the patient has been given the right prescription approach is when we deliver the medicine or the test home. So that comes in. Many times you need to connect with different doctors across the world if you were to take multiple opinions. So we do offer specialized services of connecting through telehealth, remote parts of the country, as well as specialized doctors from across the world, so that a patient that comes to Apollo gets the best consulting service possible. And all of this is possible only if you build an ecosystem where doctors, paramedical staff, nursing staff are properly skilled. So therefore, education, skilling is an integral part of capability or competency building, which enables Apollo people or the Apollo staff to deliver the best possible patient care. And hence, we give utmost importance towards skilling of our staff, which is a continuous process. So therefore, in a nutshell, I would say integrating primary care, secondary care, tertiary care, quaternary care, all brought together through technology, and making sure that we build a collaborative network of clinicians and paramedical staff that are focused towards, building a patient-centric organization has always been the motto of Apollo, has always continued to be the guiding light of Apollo. And I'm very happy to be a part of this family.
Dr. Karthik discussed how Apollo recognized the growing interest in wearables and remote health monitoring, and established Apollo Telehealth Services to connect primary care centers across the country. Apollo's commitment to patient-centered care and improving clinical outcome has led to participation in 19 countries, with an ongoing commitment to expand their footprint. A quick announcement before we're moving forward. If you are a healthcare entrepreneur and startup founder looking to accelerate your social mission and increase profitability, don't hesitate to reach out to me on LinkedIn. Let's connect and discuss how we can take your healthcare business to the next level.
It sounds amazing in the way of not only we have the first line of provider to assess what needed to be assessed. And that's really a big thing about if you engage with the right resource at the right time, then you cut down the potential need of going to the ER. Because in the US, at least 50% of those ER visits should really be carried out at outpatient primary care or subspecialty, but they just don't have the right resources. They don't know who to see, or it's too hard for them to get to that place. Then they end up using urgent rooms and ER way too much that it shouldn't be allocated. Then I also understand, Apollo, since you guys have a big program with telemedicine and be able to bring people to the right provider much sooner. And there's also a big movement nowadays in the US where I am on different devices that are wearable, digital technology, digital health to be able to track and then manage these chronic diseases remotely. And then when we're able to capture these data points, whether they're too high, too low, based on our parameter, we can actually proactively reaching out to the patient. What's that trend looks like in India for Apollo right now?
Well, I think there is a lot of interest around wearables and wearables-led monitoring of vitals, monitoring of parameters, monitoring of health. With Apollo, we could actually build a network of primary healthcare centers. And to add to it, what were those specialties that actually took forward-looking step or the first step towards being able to remotely connect patients with the doctors? I think the first one was cardiology. So telecardiology became a very interesting aspect of monitoring heart rhythm, heart rate, and potential changes in the ECG if one were to detect a potential cardiac event early on. Also, in and around the same time, teleradiology services were evolving really well because there's a lot of radiology work that happens worldwide where India is seen as an expert country where you have trained radiologists who can read the image, be it ultrasound, digital radiography, CT or MRI, and you can report. So with that, what happens is you are able to offer telecardiology and teleradiology services. Then came the advent of teleophthalmology. So in teleophthalmology, it actually enables reading, the retinal scans. Now, the retinal scans actually helps in diabetic retinopathy and also in detecting hypertension, because patients with high blood pressure seem to have changes in the retina which are not noticed, which are actually noticed early on, but not diagnosed early as part of symptomatic diagnosis or treatment. So therefore, teleophthalmology took a significant leap in the last 3 to 4 years, where again Apollo took the first step. So finally, you would look at telepathology. There are multiple remote areas in the world, including in the Asian context, where people do not have access to labs. And laboratory techniques, lab pathology investigations are very important, very critical when it comes to making the right diagnosis. And that is where what Apollo did, it is actually integrated a network labs, where through artificial intelligence, you can actually now prepare a slide, prepare an image using, minimally trained staff, put the slide under the microscope, and then read the image that's captured by the microscope, compare it with a database of similar images, and then come with a provisional diagnosis. Therefore, using technology to deliver access to the remote parts of the country, to remote parts of the world, is something that I think Apollo Telehealth tried to establish early on. And today we do the maximum number of reads when it comes to teleradiology. We have the maximum number of patients receiving our services on telecardiology. It not only facilitates first opinion or second opinion types of services, many a times it also facilitates access to patients from multiple emerging markets who are looking forward to receiving quality care at affordable costs. So that is also where I think we are able to make a difference. And that is what makes us, kind of take specific steps towards increasing our footprint currently to around 19 countries. And that is only that the footprint of that is only increasing as we speak. So we look forward to many more partnerships coming our way, purely basis, I would say, our value towards patient centricity and our ability to drive better clinical outcomes in patients.
Yes, exactly. And definitely, I have been partaking in helping some of the practices hospitals to set up those type of services, especially you mentioned cardiology. There are from heart failure to rhythm issues to basic blood pressure, coronary issue. There are multiple different ways that you can monitoring these patients' care, but sometimes it can be very fragmented. One device do this, one device do that. And then since their data point don't communicate with each other, then the burden is back on us as providers to say, how do I extrapolate all those data point, analyze them myself, and then I have to scan them or somehow convert it into my own medical record system. It can be very chaotic. So, part of my work had been help that streamline, right? Because if we actually create more work for ourselves, and then it's actually not helpful to populate, to analyze, and then decipher. It just become more data point, right? And for us, it's definitely about having the right tools in the right place for the patients. And then I love the idea of ophthalmology, same thing, because when patients have different surgeries, right, for cataracts, whatnot, and then even corneal injection, sometimes they do need to tell us more of the physiological symptoms throughout their pre and post-op period. So then it helps from a provider's standpoint, should they get treatment sooner or they really can't wait later on, right? And therefore, having the ability to track and then be offered these tele services, then to decide, okay, now you really have to see us because now we need to do procedure. And it helps the patient to say, because they're from these far away remote areas, it's hard for them to get off work, or they're elderly, they're simply difficult to get into a city to see a physician anyway. We have this incremental of tracking, analyzing, teleconferencing, and then deciding what the right method is for their treatment, then bring them in, right? And it just speed up the way that we deliver care. And especially at Apollo, you guys have so much integration into medication, into treatment plan, into different subspecialty. So it's easy for people to get that second or even third opinion if they wanted to, instead of waiting to see who should I see, right? And then who's that big list of physicians of that one subspecialty you recommend, and then start to figure things out. Definitely, no matter which country we're in, healthcare itself, it can be difficult, right? And then definitely the India and US both have the private side and the government side, but we in the US rely more on the private side. So it as a patient access standpoint, even those of us who are in medicine can still have difficulty navigating the system for ourselves and for our family. So having this integrated way of, as you guys are saying earlier to me, which I love very much, is that despite it being around for so many years, you guys think as a startup, because the if we keep that mindset of continue improving, continue innovating, then we are not going to say we just do what's can be done, what's already been done, but what can be better, right? How can we stay excited and moving forward? And that being said, what is the bigger goal for Apollo at this point? What are you guys wanting to go or focusing on right now?
I think uh, wise men have already said data is the new oil. So I think we are truly looking at how we can leverage data, because we have a huge amount of data. I think the word big data should not be used. It's been used multiple times in different contexts. I would rather want to use the word valuable data, which can give us insights. So, two big things, if I were to say. One, what is it that we can do with the data that we already have? I think we can do quite a few things. Number one, it can actually contribute to a lot of evidence generation. So as long as we have the consent of the patient and we are able to use anonymized data, it can actually give us specific disease trends, epidemiology trends, and it can also give us very specific insights about publishing data on, you know, outcomes measurement basis the kind of therapy a patient has received at Apollo. Now, most doctors follow clinical guidelines when it comes to managing diseases, but most clinical guidelines cannot be used in a copy paste mode because every human body responds to therapy in a different way. So, therefore, the data that exists in the form of discharge summaries of patients, outpatient records of patients, is so valuable that if put in a structured manner, it has the power of providing fantastic insights about customized medicine. We are getting into the era of what we call personalized medicine or personalized healthcare, where in a possibly in the matter of the next couple of years, in the very near future, every patient will get a customized therapy which works best in their human body. So it's not that every patient takes a 500 milligram tablet. So we will get to that era of personalized medicine very soon. And I think data is the one that will take us there. So my first focus for Apollo is to look at how can we make sense? How can we get the right insights from data? The second important thing that we're focusing on is what we call patient reported outcomes. Now, this is the next horizon of leveraging technology. So all of the technology we've discussed till now is about how can we make sure that we can use technology to diagnose disease in patients? How can we use technology to help a patient receive consultation or therapeutic advice from a doctor? And how can we then follow up with a patient using technology? And how can we make sure that the doctor and the patient stay connected? And how can we keep sequential medical data like an electronic health record or an electronic medical record? All of these are basically interactions between a patient and a doctor when the patient and the doctor are either virtually or in person, face to face, in front of each other. But the next horizon or the next question is what how can we use technology to keep track of the health of a patient and his outcome or his or her outcome when the patient is not inside a hospital, when the patient is not under supervision of anybody, and the patient is at home or in the office? I think that is where technology now is in its next phase of what we call either a phone app based or a wearable technology based monitoring of patient reported outcomes. When the patient is taking a therapy, especially chronic diseases, patient is on almost lifelong therapy, long-term therapy, there may be new positive effects, there may be new side effects which may be noted, which are previously not known, and the patient may have new clinical benefits or outcomes to report while the patient is at home on therapy or while the patient is carrying out their daily routine work, maybe even in the office. And the patient has now access to technology which helps them record it instantly. And that sends a notification back to the treating hospital, to the treating doctor. That is now contributing to new data or new insights. Previously, it was limited only to what we used to call pharmacovigilance data. And pharmacovigilance data, to a great extent, used to be just reporting adverse events or side effects. And that's just one part of a much larger story, a larger information that you can get from real time access to patient reported outcomes. So, broadly, I think I would say the true next, you can say, horizon for an integrated healthcare service provider like Apollo would be to look at data, making sense of data, getting right insights from the data, and to very closely look at how we can leverage patient-reported outcomes using technology. That's how I could summarize it.
Dr. Karthik provides valuable insights into the role of data in modern healthcare during his discussion. Data can contribute significantly to evidence generation, offering insights into specific disease trends, epidemiology patterns, and outcome measures based on individual therapies. This real-time reporting of clinical benefits, side effects, and other relevant data allows for more comprehensive patient care and is in line with Apollo's commitment to integrate healthcare services. Don't miss out on any episodes. Subscribe to our podcast today on your favorite podcasting app and get the latest insight from our experts. Together, let's rewrite the rules for your business and create a positive social impact in the healthcare today. All right, let's get back to the rest of our show.
I think those are two very crucial points, because when we have many data points, what do we do with it? We always wanted to make sure they are to the patient's power, and as well as helping us to be able to predict in these similar cases, how is that progression of disease and treatment and going to lead us to a better place, and to be able to look into a data point and control some factors, because as you're saying, people are different. Just because we grew up from the same family, same region, the way that we have taken in our diet, the way that we exercise, the way that we had exposure is very much individualized. And therefore, we can use this data to help us to do those true personalized medicine, and not just to say, well, we wanted to take patients' perspective into the equation of how they wanted to proceed, but also give them the actual data point to say, this is what we have found in your case. And as I'm in heart surgery, we have the Society of Thoracic Surgery making the predicament of mortality rates, morbidity, how long potentially patient might be chances on stay on vent. And we're able to give those predicament to the patient before surgery to help them to understand their true risk, and or there's a very minimal risk for a better survival benefit. And versus the other side of what digital technology can do is, for most of us providers, we don't know what happened to the patient. You can do as many patient education as possible. However, then we putting the accountability back to the patient to say, well, now I give you all this information, be a good patient, go home and do it. But then we have no way to actually know. And the early stages for you guys already started with the cardiology patient, which is amazing. But we can actually do it for all chronic diseases, both from the devices of tracking certain vitals and also symptomatic physiological side. And also, what we have found in some companies in the US we're already able to do is to even add in that wellness side based on patients' functionality, whether they're in wheelchair, they're very low function, they can only do exercise in bed or sitting, versus those who are very active, even in the older age. So we can create those specific rehab activities for those patients. Same thing as their nutritional plan, and having someone who's in the palm by an app or a complete virtual care team to track and to communicate with this patient, they no longer feel like, oh, I have to keep everything myself and worry about my health on top of everything else that we have to do for life. So it's amazing to primary focus that you guys are engaged in. I'm so excited and can't wait to see all the new growth and how this rest of the year going to plan out. Definitely would love to stay in touch. How would people be able to contact yourself or know more about Apollo Health? What's the one way that people can find you guys?
Oh, well, we have a well-stocked, comprehensive website. Someone is interested to know what we do across the Apollo network, I think the best source is to look up apollohospitals.com or Apollo 24/7. I think you have access to everything to do with Apollo over there. You can access the web version, you can access the app, As I mentioned to you, both are quite popular, quite dynamic as well. That'll be the right way to look at all new trends, news and events around Apollo hospitals.
Perfect. Yes, you guys have a very comprehensive website, and I definitely encourage everyone to check it out.
Today, we unlock the power of data on a transformative journey with Dr. Karthik as he guides us on how Apollo International Hospital is able to drive patient-centered care through data across multiple countries. Here are the 6 major points we have discussed. Number 1, quality accreditation. The International Healthcare Accreditation received by Apollo Hospital emphasized the importance of adhering to global healthcare standards. Healthcare leaders can prioritize accreditation to ensure high-quality care delivery, and it's honor in itself to receive. Number 2, data-driven proactive care. Dr. Karthik discussed the trend of data-driven proactive care in the best way to make better decisions on clinical outcome and finding out side effects before patients experience them. Apollo's use of wearables and remote monitoring devices help identify health abnormalities promptly, allowing timely interventions. Number 3, improving access. Recognizing the challenge of integrated disease management, Apollo aims to simplify the process. They offer consultations, diagnostics, and medical delivery, all integrated seamlessly for patient convenience. Number 4, evidence generation. Apollo's commitment to leveraging patient data for evidence generation highlights the potential for healthcare institutes to contribute to medical researches and epidemiology. Given this, we can explore opportunities to use patient data for research purposes while respecting privacy and consent. Number 5, personalized medicine. The discussion on personalized medicine underscores the roles of data in tailoring treatment to individual patients. Healthcare innovators can consider how data-driven insight can lead to more effective and personalized healthcare interventions. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.